a comment from a viewer saying statins kill. A few minutes later, I saw an article by Mayo Clinic about weighing the benefits and risks. So it got me going, and again, I'm doing another series on statin benefits and risks. I've done a couple of them so far, and I'll do several others. We'll talk about what those are and actually, let me just go through the items real quick. Yes, statins kill. I think everybody that's used them would agree, but it's sort of like airplanes kill too, and cars and trucks and antibiotics and water and oxygen, they all kill. The question is not whether they kill. The question is, do the benefits outweigh the risks? I just did a video on David Diamond's STEM Talk 41, where he talks about absolute versus relative risk and saying people are lying with statistics. No, they're not. And I go in and do a rebuttal of this issue about absolute versus relative risks. Again, I have at one time over half of or between a third and a half of my patients that I would recommend statins for did not take statins. And that's fine in terms of making your own choices. A lot of people choose not to fly. Some people choose not to drive, etc. So I'm okay with people not doing it, but I'm not okay with people not understanding the details. And that's what this series is about. I've done a couple of videos on Rory Collins and the statin trialist groups. Their position would be similar to what mine and I think a lot of people's position, and that is, yes, you do get side effects and you can get rare deaths with statins, but the benefit is huge compared to for a low probability group like David Diamond was talking about. No, you shouldn't take statins. But if your risk is 10%, 20%, 40%, which you can find with CIMT, this issue of relative versus absolute risk becomes a non-issue. We covered in the last video the JACC, Journal of the American College of Cardiology, issue about relative versus absolute risk. Some of the lay press, like David Diamond's video, and the profound impact it's had on public health with so many people stopping their statins. Again, today's video is going to be about the Mayo Clinic. Very practical if you're taking a statin. If you're not taking a statin, you probably should skip over this video entirely. Maybe not. You may be interested. So here's the thing. Mayo Clinic, statin side effects. Well, before I do, just one other comment. I'll also be doing another video a little bit later on liver safety. There is actually, believe it or not, a statin liver safety task force. And again, the short version on that, a spoiler, is if your liver enzymes don't triple or go over 3 times the higher limit, then you're safe, believe it or not. So back to the Mayo Clinic article and the very practical lay press article. Statins have been highly effective, safe for most people. They've been linked to muscle pain, that rhabdomyolysis that I talked about, digestive problems, mental fuzziness, etc. Researchers found a nocebo effect when it comes to perceived muscle pain and statins. What is a nocebo? A nocebo effect means people have negative expectations about a medication. They report experiencing the potential side effects at higher rates than the drug actually causes. Now, I have a lot of disagreements with Mayo Clinic. For example, they say, I have disagreements with them about metformin, but that's a different issue for a different time. I agree with them 100%. And Jack talked about this as well, the Journal of the American College of Cardiology. This nocebo effect is killing a lot of people. Very rarely, statins can cause life-threatening muscle damage. It is life-threatening, and it is rare, and it's called rhabdomyolysis. And again, rhabdo is the medical term for muscle. It can cause severe muscle pain, liver damage, kidney failure, and death. The very serious side effects risk is extremely low and calculated in a few cases per million people taking statins. Let me just say that again. Risk of very serious side effects with statins is extremely low, a few cases per million. So again, I'm fine with my patients that choose not to take statins, but you need to know the facts. Okay, liver damage. Okay, occasionally it can cause liver damage. If the increase in liver enzymes is mild, continue to take the drug. As I said, we'll cover that in another video. Basically, mild means anything less than 3 times the upper limit of normal for liver functions, liver enzymes, ALT and AST. But a practical component, contact your doctor immediately if you're taking statins and you have unusual fatigue, weakness, loss of appetite, pain in your upper abdomen, dark colored urine, or yellowing of your skin or eyes. Again, those are classic signs of liver disease. Increased blood sugar or type 2 diabetes. Some people think that it causes diabetes. It doesn't cause diabetes. It does increase insulin resistance. And that's a major issue that I have in terms of statins, because my whole legacy goal right now is to get people to understand how many of us, as in way over half of us age 60 or older, have insulin resistance. Now, and so statins make it worse, so why would you give them? A couple of points. Number one, 2 or 3 points. Number one, the lower dose statins don't cause as much. For example, low dose Crestor generic rosuvastatin doesn't cause so much. Number two, there is a statin now which actually helps to fight insulin resistance. That statin is called Livalo or pitavastatin. Up until this year, though, it was rare to write a script for it because it costs so much. There are some ways to get pitavastatin now at better costs. It still costs a lot, though. The other statins tend to cause a little bit more problems in that area, and especially higher dose statins. So back to the article itself. Statins prevent heart attacks in people with diabetes, so the relevance of mild increase in sugar values with statins observed in some people is unclear. The benefit of taking statins likely outweighs the small risk to have blood sugar level go up. Talk to your doctor if you have concern. Neurological side effects. Some people have talked about memory loss, brain fog, confusion. These side effects reverse once you take the medication. There's limited evidence to prove a cause-effect relationship there. That's why it wasn't even listed in some of the other groups, like Rory Collins's group. There's also been evidence that they may help with brain function. For example, in people with dementia. This is still being studied. Don't stop taking your statin before talking to your doctor. Who's at risk of developing statin side effects? Here's some of the risks. Taking multiple medications to lower your cholesterol, being female, smaller body frame, being 80 or older, having kidney or liver disease already, drinking too much alcohol, and having certain conditions such as hypothyroidism or ALS. How to relieve statin side effects? Take a break from statins for a week or two. Switch to another statin drug. Change your dose. Lowering your dose may reduce some of the side effects. Now, according to them, it may reduce some of the cholesterol lowering benefits. And again, according to me and a whole bunch of other people, it's not cholesterol lowering anyway. It's the cardiovascular inflammation lowering. Take it easy when exercising, and that's just unaccustomed, vigorous exercise. I have a lot of folks, myself included, who do very vigorous exercise on low-dose statins. I had some problems for a while with some calf cramping, but again, not that bad. And I didn't stop my statin. I have vacillated between 5 milligrams per day of rosuvastatin or Crestor down to 2.5 milligrams twice a week. And I watch my CIMT results to decide what level and what dose I take. Consider other cholesterol-lowering medications and try CoQ10 supplementation. I just had a viewer comment about making sure you take your CoQ10. Other folks would also say take vitamin D3. Weigh the risks and benefits. Although side effects believed to be caused by statins can be annoying, consider the benefits of taking a statin before you decide to stop taking your medication. Remember that statin medications have reduced the risk of heart attack or stroke, and the life-threatening side effects are very low. As I would quote from the JACC article of a couple of years ago, research estimates would indicate that between 2,000 and 6,000 added deaths have occurred in the UK alone from people hearing these videos and saying, I'm going to stop my statins. There's just, where there's smoke, there's fire. If you've read about the potential side effects of statins, you may be more likely to blame your symptoms on the medication, whether or not they're truly caused by the drug. And again, that's the, quote, nocebo effect, end quote. Even if your side effects are frustrating, don't stop taking your statin medication for a period of time. Again, plenty of people have stopped statins safely, but I've got a series of four studies that I reviewed that looked at stopping statins. All of them said, you know, a week or two is okay, and again, this article would even recommend a week or two. But to stop them entirely for 6 months, if you have cardiovascular inflammation, you're increasing your risk again. Even your doctor may be able to come up with an alternative treatment plan that can help without these side effects. So again, I hope this article is a little more practical for some of you who want to know just, okay, what would you recommend in terms of me looking at potential side effects? What are some practical implications? If you made it this far, thank you very much for your interest. If you hit the like button, and for sure if you subscribe or share, the algorithm reads that as a strong message that humans think this is interesting and important information. And the algorithm can share it more than any of us humans. Speaking of sharing, one of the best ways of sharing is on social media. We've got active Facebook, Instagram, and LinkedIn activities going on right now. We've recently started up things in Pinterest and Twitter, so we'd love to see you there. Check us out. Finally, with over 500 videos, a lot of people are saying, I can't find this video or that video. Our new social media manager, Kim Hermosa, is starting to work on ways to help with that. So join the community. You can click on the links below, and you can get a little bit better access. Thank you again for your interest.